presenting author is Dr. Chavan Pooja Vishnu. Yeah, okay. So you are presenting on the clinicopathological study of benign and malignant eyelid tumors.
Good morning everyone. I am Dr. Pooja Chavan presenting on clinicopathological study of benign and malignant eyelid tumors. No financial interest. The eyelid tumor present a crucial aspect of in field of ophthalmology and most frequently encounter neoplasm in ophthalmic practice. These tumors were known to affect all the age group and gender and ethnic with the and ethnic background, and these encompass 90% of ocular tumor manifesting on the eyelids. The lead tumors are most prevalent neoplasm and this encompass diverse area of benign and malignant tumors. These are not only the source of aesthetic concern for the patient, but they pose diagnostic challenge for the primary care physician. The understanding the clinical and histopathological characteristic of eyelid tumor help in early diagnosis and management of the eyelid tumor. Aim of the study is to study the clinical profile and histopathological feature. The objective is to estimate incidence of eyelid tumor with respect to age and sex, and to compare the clinical diagnosis with histopathological diagnosis. Inclusion criteria were both malignant and benign and malignant tumor based on clinical diagnosis, which were subsequently confirmed through histopathological examination. Inflammatory lesion were excluded from the study. My study is prospective study done in the Government General Hospital of Kakinada over 30 patients over the period of 1 year. The primary source of data is clinical examination and medical records. Medical record include the patient's medical history, clinical presentation, diagnostic test, and pathological report. The pathological specimen played a crucial role for confirming diagnosis and studying the histopathological feature. The mean age of presentation for benign tumor was 47 years and malignant tumor was 62 years. Male predominated were the female, and 60% patient had mass lesion over the upper lid, followed by lower lid and medial and lateral catheters involvement. 25% cases showed lid margin involvement. The clinical presentation of eyelid swelling, the most common clinical presentation was eyelid swelling followed by ulceration. The most common benign tumor was seborrheic keratosis, and most common malignant tumor was basal cell carcinoma. Benign tumor were mostly well differentiated, while malignant tumor showed a mixture of well differentiated to moderately differentiated pattern. Our study was in our study malignancy rate was 40%, with BCC being most common malignancy and male predominance over the female. Intraocular invasion and metastasis was rare, but orbital involvement were seen in few cases. Our study was mostly similar to other studies, but Depres and Rajendra Kumar studies showed the sebaceous cell carcinoma being the most common malignancy. This study is comprehensive clinicopathological study of benign and malignant tumor. Benign tumor were were more common, and age distribution varied between the two age group. Basal cell carcinoma was prevalent to malignant tumor, while squamous cell papilloma was most common benign tumor. The upper lid lesion were more common compared to lower lesion, medial canthus and lateral canthus involvement and lid margin involvement. And this study emphasizes importance of accurate diagnosis and histopathological evaluation for appropriate management.
Histopathological diagnosis you did, I mean, did you mention them in your slides? And what did you do? I mean,
I took help of pathology department.
So did you do excision biopsies and all for all of them?
Yes, ma'am.
At your at your medical college only, in the pathology department?
Yes, ma'am.
Okay, fine.